and welcome to the latest episode of the ThinkingCAAP. I am your host, Amanda Hoprich. Joining me today is my co-host.
Hello, Beck Moore, CEO here at CAP. And we also have a special guest with us today, Jen Wintermyer, who is the CEO of TriCounty Community Action. Hello, Jen. Thanks for being here.
Oh, hello. Thanks for having me.
You didn't really have a choice, to be fair, but
That is true.
but thank you. We're happy to have you.
We're very excited to jump in with Jen today and talk about we've had shout out to episode 2 we had with Karen Van Zandt and some of our latest episodes. And one of our favorite topics in talking about social determinants of health, and why we're so excited to jump in with Jen is the creme de la creme, shall we say, the epitome of where the rubber meets the road in community action in bringing all of the theory and foundations of social determinants of health and how it works in our community action programming.
I think one of our gurus, that's what I would say. One of
No
our
One of our
pressure at
gurus.
all, right there. No pressure.
Well, you're someone, Jen, that early on, absolutely, it really helped me to understand a different framework for the work of community action and how we started to translate then our networks
Hmm.
work
Yeah,
through a different lens, right? Because as we've talked about on prior episodes, if you go back to episode 3 with Denise Harlow, she talked a little bit about the framework of community action. You're featured in our video, of course, on our website, thecap.org. And you share kind of the differences and approaches of our
right.
organizations. And you really help us to reset on the storytelling that we need to do. Because it's not always about the program, right? It's about the framework.
Exactly.
So, Amanda, kick us off here with some questions. Keep us on script. Otherwise, Jen and I will just go off on our own
I'm
tangents.
very excited. So, what I would love to pick your brains, Beck and Jen both, is jumping right into the foundational understanding when we talk about, to your point about how Jen sort of helped frame this. But what are some of the key elements to understand and consider when building, your case for support, really focused on social determinants of health in a community action agency? What are those key elements you see?
Yeah, I think some of the core key elements is knowing what your data is and what that data is telling you. And I guess the best way I can reference that is if I go back to when we first started thinking about social determinants of health and when we first started using that language. And that was about 10 years ago now. And it was around the work that we were doing in one targeted census tract in our 3 county footprint around community planning, community revitalization, and community development. And that process involved going out to the people who lived in the community and saying, what are your values? What do you want to see about your community? How can you be part of that solution? As well as doing a whole lot of data gathering. And what we found when we were talking to folks and we were starting to develop this comprehensive plan for this neighborhood, we realized that people were telling us it's great if you tackle safety and it's great if you can reduce traffic and it's great if you can attract new business, but we feel like crap. And none of that stuff matters if we still feel like crap. And so we started looking at health data. We started pulling this all in and saw that the people living in the census tract were living more than 5 years less than their neighboring census tract within the same zip code. And then we were seeing that they did not have access to grocery stores that either accepted SNAP benefits or sold healthy fruits and vegetables. They did not have access to free recreational facilities. And then we began looking at, okay, if you don't have access in your neighborhood, where are you going? And we saw that folks were walking. And so we walked literally alongside them and saw that they were crossing busy roads that didn't have crosswalks and were poorly lit and intersections where traffic wasn't managed well. And they were having to go by properties and entire blocks that were blighted and vacant and just pulling all this stuff in. And we went to the police department and we used a criminologist to help us get crime data and overlay that. And we just pulled all this data in. And so we had a tremendous amount of data and we said, we don't know what to do with it. Right. And so our first reach out in this world was to then say, we need some expertise to help us understand what all these data points mean, help us see the intersections, and help us determine what the best plans are for the residents of this neighborhood. And we ended up going to a health plan in our region and saying, for a completely different reason, but at the end of it, we said, oh, by the way, we really need help understanding all this health data we have, and we really need help pulling together this. And that piqued their ears. And they said, you know what, we have a lot of members in that area, and we'd really like to know this stuff too. And they actually funded our first study that we worked with a local university on to understand what the social determinants of health meant in this community and how we can improve the health and well-being of folks living in this community through built environment. And that was all before COVID. Right. And so we were thinking about that from the idea of built environment. And then post COVID, when a lot of the changes started coming out of CMS, and we started to hear a lot about value-based contracts and this mandate for healthcare and managed care organizations to begin working with community action agencies, we had already been using the language and the framework, and we had already understood how what we did impacted the healthcare world and how we can begin to utilize our data in that way. And so I think, one of the foundational elements really is, what's your data? What can you do with it? And be honest, what you can't do with it as well. But I think that was really core for us, is it started all with data.
I love all of what you just shared for so many different reasons. And I just want to make sure to remind our listeners that if you are a community action agency in Pennsylvania, we provide some pretty amazing technologies
Yeah.
to help understand deep community needs. So if you don't know what those are, please reach out to us. We want to make sure that you're connected to those particular tools. So I want to take a step back for a second, and if you can a little bit, then I want to get back to some of the data pieces and what you described about walking alongside someone, because I think that that is just such an amazing distinguishing point that is so important to do this work. If you can give us some framework of TriCounty and some of the programs and services that you run, just so that people can understand a little bit about who you all are, because we had, Erin Lucas from Bucks County Opportunity Council on a prior episode, episode 4, and she shared about some of her framework and some of her programs. I just want to give our listeners a little bit of perspective about some of the differences in the approach that we've talked about a number of times.
Yeah, so at Tri-County Community Action, pre-COVID, we really worked hard to define our theory of change and to understand how the different pieces and things that we do fit together towards a collective impact in our community. We are a 3-county, 1,700 square mile, incredibly diverse footprint, diverse in the people who live there, diverse in the types of communities that are located here. And we are the epitome of what we do in one corner is very, very different than what we do in another corner. And so how do we
Absolutely.
tie that all together? And so we started with our needs assessment data. And I hate to be that person to say needs assessment, because sometimes that could feel like a compliance tool, but we really look at it as the tool it's intended to be. Help us better serve our community. And we saw that in our community, we had those, we call them health related social needs, right? So we had
Absolutely.
things,
Yep.
people who didn't have a behavioral health or a physical health home. And because their behavioral health or physical health was not managed well, they weren't able to move forward in any of our programming. We also have stagnant wages, and we have structural inequities, and racism is alive and well. And we have all these conditions in our community that we're trying to tackle at the same time. And so we break our programming down into 4 buckets or 4 pillars. And all of them are focused on not just disrupting the cycle of poverty, but breaking it entirely. We like to say that, we don't want to make poverty more comfortable or more tolerable. We're trying to eradicate it entirely. And we do that through a holistic, comprehensive, whole family 2-gen approach, whatever cliche you want to use, but it's addressing the needs of everybody living in that household as well as the community. So our 4 buckets, the first is early childhood and family development. Start with families prenatal and work
Absolutely.
with them until the youngest child hits kindergarten. making sure that the children are school ready through an evidence-based home visiting program, as well as the parents supported in the ways that they need to have healthy families with good structure and well-being. And I think sometimes when we think about early childhood, we don't realize the impact that has, because we check a box and we say, okay, kiddo got to kindergarten, that's great. But the reason why that's so important is by grade 3, children make the shift from learning to read to reading to learn. So if you're not at reading level at grade 3, you can begin to see those life challenges already stack against that kiddo. And so
Oh,
if we can
absolutely.
get you ready on kindergarten, hopefully you can stay there until you get to grade 3, right? But families that are dealing with the realities of a loved one with addiction, newly postpartum birth givers, disconnected dads or single dads, fatherhood programming. So all this overlay we do to make sure that family unit is strong while that kiddo is getting ready for kindergarten. Our second bucket is our employment, education, and financial empowerment programming. And this is really focused on the adults and doing everything we need to do so that they can move off of the public welfare system. And so that is addressing housing, that is addressing education and employment. That's not just teaching people how to budget, because I think when you do this work for a long time, you realize that somebody with a limited income, I'm not going to tell you how to budget your $1,200 a month any better. You are already doing it in an amazing way. The issue is not that you don't know how to budget, it's that you don't have enough resources coming into the home,
Right. You can't
right?
budget your way out of poverty.
Exactly.
Right.
And so, working again with the adults to get them to that place that they have stable employment that supports their family in a meaningful way. Our third bucket is housing security, and this might seem a little misnamed, but for us, our role in the housing continuum is not necessarily the rent checks or that type of supportive housing for those who are chronically unsheltered. For us, it's once people get housed, we want to keep them housed. We want to stop that
Sure.
cycle from starting. And so it's done through utility assistance programs, it's done through supportive case management, it's done through we do a lot of landlord tenant eviction mediation. We do a lot of, again, that preventative work. You're housed, and whatever housing level that is for you, let's keep you housed. And then our fourth is that very focused community development. Strong families need thriving communities. And again, it's so important when we think about the neighborhoods that families live in. Everybody wants to live in a healthy neighborhood. Everybody wants to have a great school district. Everybody wants their children to be able to play outside and be safe. And so we engage residents in that solution finding in their own neighborhoods.
I love all of that. Thank you for
Mhm.
that perspective. I think it's important for people to understand just how deep, you're looking at the work, and it's, as Megan Shreve, one of our other executive directors, talks
Mhm.
about, right? It's micro and macro level work,
Exactly.
and
Yeah.
it's layered. It's so layered.
It's complex, right?
Yep. So want to go back to something you shared about the data piece. And one of the things I say all the time, and people frankly are probably tired of hearing me say it to a certain degree, but you can't really help in this world, in this work against eradicating poverty, unless you understand the inequities that exist. You can't,
Yep.
right, fight to help people through some of the inequities and disparities unless you understand the deep systemic challenges that
Mhm.
exist in a local neighborhood or
Right.
within the context of where someone lives. And so the data component is so, so, so important.
Yeah.
One of the frustrations that I know that we've talked about is, and going back to the topic of healthcare and the relationship between nonprofits and healthcare. And this is, we can get a little heated about this. So I want to remind us that we're on a recorded line right now. There is this perception of healthcare, of nonprofits,
Mhm.
right? And the lack of understanding of data, our access to data, and our ability to analyze that data. We know in community action that is not true for us.
Right.
What's your reaction to that?
To remind myself we're on a recorded line. Yeah, I think
I love that
so.
you're both playing nice, though. Thank you.
I,
I mean, Jen and I cuss a little when we talk about this, so I'm gonna hold back. I'm gonna do something that I don't typically do. I'm not gonna let the bad words fly. I'm gonna
right.
recognize that.
Yeah, I think there's a couple of layers. If I were to be really philosophical and think about this really deeply, is we in community action are used to data. We live with it, we explore it, we do meaningful things with it. It is who we are. It's ingrained into our fabric. Healthcare is looking at nonprofits or community-based organizations on a very different level. They're not just looking at community action agencies. So it's really frustrated when, as a community action agency, you hear somebody from the healthcare world go, community-based organizations don't understand data, right? And we jump up and down and we get really angry. We're like, we do. So understanding their perspective, that they are seeing not just community action agencies, but they're also seeing the small, maybe faith-based, all volunteer-led, mission
Right.
focused
Local
emergency
food
service provider,
pantry,
right?
right?
Right.
Yes,
That runs a small human services fund, things like that. So understanding that they're looking at a full spectrum, I can understand where that comes from in their eyes.
sure.
I think the opportunity for community action is to stand up and educate and say, we're not that, right? We are highly
Complex.
sophisticated. We receive millions of dollars of federal funding. We know how to braid and blend, and we are audited to the highest levels. And we have all these complex integrations internally and externally. And it's normal for us because it's who we are, but we're an anomaly in the community-based world, I think.
Yeah, and I asked that question mainly because I want to make sure that we're really telling the story about who we are and the
Hmm.
complexities of what we represent, and
Yeah.
that's not a fair assumption. Just like everything, right?
Right.
There's a range
Right.
of organizations and their complexity and their abilities. So it's an important thing that distinguishes us, and it's baked into our fabric because of how we have to report. And when I say
Right.
we, I really mean our network, right? And so I want to make sure to lift that up. And the other thing I just want to recognize is I want to go back to something you said in the very first question, and then I'll let Amanda ask her next question, is that concept of walking alongside someone,
Yeah.
right? We think that we understand because we've seen a movie or maybe we've seen someone walk down the street. But until you've had to ride your bike to work along a highway,
Right.
you don't really know what it's like to literally risk your life or your children's lives just to get them to
Right.
point A to point B.
Exactly.
And it's just, right. I think that's such a, again, an important way that you thought about how to approach the work and that you've continued to look at how people have accessed different programs and to make pivots. Like I know at one
Hmm.
point you all had a food market, a fresh food market in the Allison
Yes.
Hill neighborhood in
Yes.
Dauphin County, which I'm familiar having worked in an office in that neighborhood.
Yeah.
You saw that people weren't accessing it because they were getting that service somewhere else. They had that built into their it was an unclear, I
Right.
think, right reality of what you thought you saw. And you
Yes.
all pivoted to adjust
Yes.
the approach. And I also just want to say that I commend that because not everyone is able to make that kind of pivot.
Yeah. The thing that we say all the time at TriCounty is the word action's in our name for a reason,
Oh,
right?
yes, absolutely.
And we need to always go back to the folks that we are working alongside with. And I try to catch myself and say we're not serving, because it's a weird dynamic. We're asking you to invest in yourself just as much as we're investing in you, because you're worth it, right? And we're willing to do more, and we have to do more. But right, people are investing in themselves. They're not getting just handouts and walking away. Um, but we gotta continuously go back and say, what do you need? Is this of value to you? If it's not of value to you, then it's our responsibility to shift and give you something of value.
Yeah, completely. So I know, Amanda, we want to be thoughtful about time, and our listeners have told us, right? Jen may be one of them that said don't go too long, and so we want to be thoughtful about the time that we
May have
have
said that
left.
once or twice.
So we want to be thoughtful about the time we have. So we probably have time for what? One more question, and then your big question that you'd like to ask.
Mhm.
Well, and this is so typical because you asked about, the perceived. negative is my next question that I wanted to follow up with. What were some of the successes in analyzing this data and entering into these, partnerships with healthcare? What were some of the surprise successes that you found either in the data or, engaging and beginning to develop these partnerships and where you are today from the beginning to now? Any surprise successes?
Yeah, I think, Beck mentioned the farmers market that we started, right? We came under the assumption we were looking at SNAP utilization rates, we were looking at health outcomes, we were looking at access to healthy fruits and vegetables, and we said, hey, let's start a weekly farmers pop-up market. And as an agency, we became a SNAP vendor, so we matched everybody's SNAP dollars dollar for dollar, and we did this stuff, and we continued to analyze the data. And I think one of the successes was realizing that that actually wasn't the need for folks, right? Because we have a really amazing regional food bank in our area that works with really strong food pantry partners. It required us to go back and dig a little bit deeper, right? And so we found that people, for example, didn't have refrigerators or stoves. And so buying some of these healthy, fresh fruits and vegetables and stocking up on them didn't make sense because they didn't have adequate storage. And again, I think had we not had the health partners helping us analyze and think through that data and give us the opportunity to pilot some things, we would not have gotten more to the root of how we can really help this community. Um, in our family services side, when we think about our early childhood programming and the work that we're doing around maternal health, I think we're seeing some really amazing results where we have families that were falling through the cracks before, because I think there's a misunderstanding sometimes that you must be in poverty to receive some of these programs. And the reality is most of our programs don't have income requirements on them, because they're things that all families need for all families' well-being. And we've been able to connect with those families in a very different way. And again, we've been able to go back to our health partners and say, are these meeting the needs of the people you're referring to us? No? Okay, let's add an additional layer, like the this postpartum support for moms, or like the families in recovery for families dealing with addiction. So I think some of the successes are around that data sharing and being able to say, are you seeing the outcome? If not, let's go back and let's do things in partnership really meaningfully.
I love
So
that.
I want to make sure to ask one quick question, Amanda, if we can, that I
Of
think is
course.
important because I want to make sure that we use this opportunity to help, other CBOs, other community action agencies understand the opportunity that exists and a little bit about where to start, right? So this can be these conversations that you can get into, and
Mhm.
we've presented on this topic before, and I've heard you say this, right? When you think about the very first conversations you started to have with healthcare to today, and how much you've learned about the translation of your services
Mhm.
over into this different world, where would you encourage someone to start? Where would you encourage a community action executive to start, a team member to start? How do they start to think about all of the pieces so that when they do have the conversation for the first time, they really are knowledgeable enough to hold their own in that initial conversation?
Whew, that's a great question. um, I think the first place to start is, to be very honest, have an ally of your organization that doesn't know anything about what you do, who you are. Look at your program descriptions and see if they make sense. We get
Such a good idea. Yes. I just talked with somebody else about this.
Yeah, we get in the habit, right? We speak program speak. We write the grants, we write the contracts, we speak our program speak.
We use
That's
the
all
acronyms.
that's
Yeah.
all internal, right? And I think that,
It's curse of knowledge is what I like to describe.
yeah. And that's really what led us to defining our theory of change. Is we went to our board and we said, okay, we have all this community needs assessment data. Let's strategically plan around it. And our board went, we don't really understand enough about what you do, right? So if our board, who are our number one allies, are going,
Yeah.
this seems disjointed to me,
Right.
then the people who don't have that insider knowledge are really, really going to feel disjointed.
Right.
And so I think finding that trusted ally and saying, does this make sense to you? and translating your programs and what you do at that point around somebody who doesn't have that program knowledge that you do.
And if you're a community action agency in Pennsylvania, you can always come to CAP. We have a number of consultants that will help to
Yes.
do some of that. You can meet with them, right? We take on some of those costs on your
Yeah,
behalf so that you can do
absolutely.
some of that
And
work
that's
You
been
because
could
you learn.
call
huge.
Jen Wintermyer at 555-5555.
717-232.
But seriously, if you are
Yeah.
looking for that help, that's part of why we have a robust list of consultants and people that we work with. You know, Karin, who's again was on
Hmm.
episode 2, she's one of those people at Clear, one of our great partners at ClearLink Partners, and there are others that we want to make sure to partner with and talk through some of these issues with, so that
Right.
you are ready to start to have these conversations.
Yeah, absolutely. And and I know we're joking about, calling, but that's part of, you mentioned Aaron Lucas, you mentioned Megan Shreve, right? That's part of some things that we did early on with each other,
Absolutely.
saying, how are you doing? Would you look at mine? Can you give me input on this? Here's that. And it's wonderful, again, not to toot your horn back or Cap's horn, but it's wonderful that Cap has leaned in this area and can do that, because that takes a lot of burden off of us, but it also, you're pulling in from a wider audience of experts that we
Yep.
could never access on our own. So take
Toot toot
advantage of that. Yeah.
toot toot. Thank you for that. We
Also,
appreciate
you
that.
could too, as a board member, toot.
Yeah, it's true. Thank you for that.
Mhm.
I think that's really helpful. All right,
Yeah.
Amanda, keep us on time here.
All right, Jen, are you ready?
I am.
Are you on the edge of your seat?
I, I am bated breath.
Jen Wintermeyer, what myths are you busting about community action in your community?
Yeah.
Oh, that was such a heavy. Yeah. Do you need a hug? I'll give you a virtual one.
um, I I don't know if they're myths, but I think what we are working on, and it's actually one of our strategic goals, is to tell our story differently, right? And I mentioned this before, we are an anti-poverty program. Our job is to end poverty, but we also want to prevent people from even getting to that place. And the vast majority of the people who walk through our doors have some type of income from some source like employment. Most of them are above the federal government's poverty line. Um, and that doesn't mean that we can't work with folks or don't work with folks in a certain way. But I think that's one of the myths, is you don't have to be in poverty. You have to be a person living in our community, and we'll try to connect you to a service. And if it's not a service that we provide, we'll try to connect you to somebody else in the community, right? Because it's about prevention in many cases. I think we're also busting some myths about um, related to healthcare, about our capacity to manage data, about our sophistication of our systems. I think when we're talking with friends in the healthcare world, we're doing some education around how many different systems a community-based organization like ours has to enter the same client data in, because I think, their minds, they sit with their electronic medical records, they do everything in it, they hit close, and the stuff goes to all the places it does. That's not the way it works in the social care world. We've got to use each one of those systems differently. And I think we're doing some education with folks to say, is there a way that we can pull this from an existing system for you, or do we really need to add the ninth database to our team?
Yeah,
Right.
such an important point.
Um, And then again, I think the other thing we tried to bust, and it's not really a myth, but I think what we try to explain to folks is, even if it's not a program or service we offer today, we're willing to lean in and be part of the solution. If the data shows that this is a need, we can help step in and plan to fill that gap. Because I think sometimes there's a sense when community organizations look at other community organizations, they say, oh, they're the food pantry. Oh, they do rent assistance. Oh, they do this. Oh, they do that. Well, as a community action agency, we combat poverty regardless of the cause. So if there's not somebody else doing that, we are willing to step in and be part of that solution.
You're busting
Appreciate
the
that, Amanda.
best myths
Did I answer
in
that
Cumberland,
okay?
Dauphin, and Perry counties
You answered that beautifully. I think
Okay.
it's
beautifully.
yeah. And I want to make sure to give a shout out to TriCounty specifically. And we've said this on prior episodes, but if you are someone, right, who is looking to invest back in your community, TriCounty is a great organization. If you're in Cumberland, Dauphin, Perry County, please check out Tri-County Community Action. You can go to our website, thecaap.org. You can look up right their website on our members page to find out where to contact them. Really great organization to spend some time with and just
Thank you.
try to, make a difference locally. And if
Hmm.
those counties aren't in your area where you live, find the community action agency who is and connect with them to spend some time,
Right.
helping.
Yeah, absolutely.
Well, thank you
Amanda?
so much, Jen, and thank you, Beck, for always putting up with my antics and sitting in the hot seat. Very much appreciate it. And I just want to put a shout out for our listeners. If you have any questions that you would like to submit for an upcoming episode, please email us at info@thecaap.org, 2 A's, and very much appreciate it.
Jen, thank you very much. I really just always appreciate your thoughtfulness about your answers. And I would love to have you back to talk a little bit about federal poverty guidelines. I know I've presented
Hmm.
alongside of you, and you have some really amazing insight that I think people would have some eye-opening moments
Do I
when
need like a
they're
beep
listening.
button for that one for you two, though? To keep
Yeah,
you.
you might. You might.
You might, although I do have to admit, I don't swear as much unless Beck is around, and it just comes out a little bit more naturally.
Can't help I bring it out in people. But again, Jen, thank you
That's
so
so
much.
true.
Thank you so much.
I could talk with you all day,
Yeah,
and we'll talk. I'm sure we'll talk again soon.
we will.
Thanks everybody for joining.
Thank you.
Thank you.
Thank you for being a part of this episode of the Thinking Cap. Check the show notes for resources and links to other episodes. And don't forget to subscribe and follow to be notified when new episodes are released. If you have any community action questions you'd like Beck, Amanda, or one of our local experts to answer in a future episode, please email your questions about community action to info@thecaap.org. Subject line, Thinking Cap.